Welcome to our next, recording is in progress. Good evening, everybody, and welcome to tonight's session of our IDA Florida webinar series for 2023. My name is Judy Cohen, and I serve as the current president of the IDA Florida branch. On behalf of our entire board, I'd like to welcome all of you to this webinar, and thank you for taking your time from this Thursday evening to join us. We have a few reminders before we get started. First of all, we'd like to remind everybody that our vision for IDA Florida is that all students in Florida will receive structured literacy instruction provided by effective teachers who understand the science of reading. We're happy to let you know that this evening's session with Dr. Tridas will be recorded and will be available on our website, as will his handout. So you can take notes, but just know that you will be receiving the slide deck. Let's see, everyone is muted, but feel free to use the Q&A for any of your questions or the chat tool. We will have a Q&A time available after the presentation, and we'll be manning the website here so that we know what your questions are, and we will be working with Dr. Tridas to hopefully get most of them answered. We do have a notice about the certificate of attendance. There have been some questions on that. You may earn credits toward the 20-hour ESE recertification requirement and earn in-service points toward the required 40 points needed for the recertification requirement for House Bill 7069. Participants should check with their individual county's coordinator to determine if the CEU would be accepted. However, in order to obtain a certificate of attendance, you must attend the webinar in its entirety, and the webinar must be attended live, not on recording. Attendance and time spent in session is recorded electronically during the live session. Those who attend a session in its entirety will receive their certificate in about 1 to 2 weeks following the webinar. So if you don't receive it, just please reach out to us and we'll make sure if you were in attendance, you will receive it. And now it is my honor to introduce our presenter tonight, Dr. Eric Tridas. I'm going to read his official presenter information. Dr. Tridas practiced developmental and behavioral pediatrics in the Tampa Bay area for 37 years. He is an IDA representative to the National Joint Committee on Learning Disabilities, a member of the Professional Advisory Board of the Learning Disability Association of America, and past president of the International Dyslexia Association. Dr. Tridas is the recipient of the 2017 International Dyslexia Association Margaret Rosson Lifetime Achievement Award and the 2012 IMSLEC Innovator Award. His lectures and consults nationally, and consults nationally and internationally on dyslexia and other behavioral and developmental pediatrics topics. And in addition, it is my honor to say that he is my friend and colleague, and I'm just so happy to have Dr. Tridas with us this evening. It's all yours, Dr. Tridas.
Well, thank you so much. It's a pleasure to be presenting close to home. I am going to start sharing my screen and we'll get going. What I hope to cover today is in a very short time, the evaluation of a child with reading problems. And I think that the title of the lecture, What the Heck is Going On with This Child, is a question that we have asked ourselves many, many times when we see these kids. I don't have any disclosures. So what I hope to do is to discuss the why of the evaluation, the foundation, what is the science behind it, how, what is the structure, the anatomy of an evaluation, what do we evaluate, and then what do we do with that information? Now what? Okay, so let's start with the why, the principle of consequential validity. What exactly does that mean? It means that the results of a test, which can be either positive or negative. You can have positive results when a test measures a particular skill or function accurately, when it's used to improve the student learning through test-based classification decisions, and it's ensuring equal access to content for all students, because by understanding how the student learns, we can then provide equal access to them. What are negative examples? Using tests to reallocate funding. or teaching the student the test so that they can pass it, like what we do at the end of the year. Sometimes that happens, and test that produces negative impact does not have consequential validity. So for example, a test is done on a child that is struggling to read in this case, but the child fails to meet eligibility criteria for services and nothing is done. So doing the test did not help the student because it only answered one question. It did not address the student needs. So why is it that we test? We need to get information to inform decisions. And those decisions are about how we're going to teach and treat the student. We need to collect norm reference data to compare that performance with that of their peers. That's what we do, progress monitoring, to see how the students are doing. We need to evaluate person to answer the questions that people have. What's going on? Why can't this child read? What are the things that are affecting this kid's reading skills? We need to identify the strengths and the weaknesses, both, because these are strengths that are going to help us get ahead. And we need to identify the weaknesses to see what we need to remediate to narrow the gap in performance between the students that are having trouble and those that are not. Making meaningful recommendations. In other words, I'm going to make recommendations that are intended to address the problems that the student has. One of those questions may be, does the student qualify for services? But it should not be the only question to be answered by an evaluation. And it should help us inform diagnosis, intervention, and support. Okay, so through the findings that we have, we can then figure out, oh, we know what the individual has, we know what to do about it, and what type of supports a student may need. In other words, we test to teach and treat. So what is the foundation for assessing reading specifically? Okay, so we're going to talk about the science of reading. Everything has to do with language. And we have 4 language arts skills that we teach kids, for aspects of language development. We have the listening part, listening comprehension, the speaking part, the oral communication, reading, and writing. So oral communication requires listening and speaking. The listening part is basically understanding what other people are saying, my ability to hear, because I got to be able to hear first, so my hearing acuity has to be good, and I need to be able to interpret the message. What did the person mean by what they said? Okay? And when I talk, I use my voice and gestures to share my thoughts, ideas, feelings, and emotions. So that's what I do. And that is very important, particularly in oral communication, where the gestures can help a lot, where the prosody, the tone of my voice can help a lot. I can be sarcastic. That was very funny. Or I could be laughing my head off and say, oh, that was funny, and then the same words had a totally different meaning. So in order to do this, okay, we need the components. We need speech and language, which is what allows us to communicate. Speech is what allows us to speak. And what is it? We exhale, we breathe out, and we make sounds. So we can have, we deal with articulation, the pronunciation of the sounds, okay? Voice, the vocal cords, okay? Hoarseness is a result of vocal cords abuse. That's why singers have raspy voices, because they're abusing their vocal cords all the time. And fluency, stuttering and stammering. Okay, so in order to have appropriate speech, I need to have good articulation. I need to be able to voice the sounds appropriately, and I need to be fluent. Language involves the content. And in order for me to say words, for example, I have to combine sounds into words. Words have parts. So if I'm going to, add a prefix or a suffix, a verb ending, present, past, whatever, that's a word construction. Syntax, the organization of the words in a sequence so that they can make a sentence. So a sequence of sounds makes a word, a sequence of words makes a sentence, and a sequence of sentences makes a paragraph. Discourse is just a sequence of sentences that gives us a complete thought. And then we also have semantic, and the color changes because the meaning of the word can change depending on the context in which we use it. And I'd like to use the example, give me a hand. Because I had a patient with an autism spectrum disorder, and when I asked him, give me a hand moving this here, and he said, no. He said, why? Just because it's attached to my arm. So he did not understand. He said, no, what I mean is, can you help me? And so why didn't you say so? Because he did not understand figures of speech. So the ability to understand figures of speech, irony, sarcasm, that is very important. And that's what we talk when we talk about pragmatic language skills. That's what we're talking about. And then we have the metalinguistic skills, the cultural aspects that influence language. You know, we speak English in the US, but they also speak English in Ireland and in Britain and Wales and Scotland. And we don't all sound the same and don't use the same vocabulary. So there's a lot of different cultural issues. The humor is different too. In terms of written communication, we have reading and writing. And they're both sides of the same coin. You know, at the word level, when we're trying to read a word, that's decoding. When we're trying to write a word, that's encoding. So in terms of comprehension, you know, I cannot understand what I read if I don't understand what I hear. It's as simple as that. So someone that has a language disorder that doesn't understand what they're hearing are not going to understand what they read, even if they're good decoders. The same thing happens with, you know, oral and written expression. That's why when you look at tests, when they talk about language or communication, they look at oral and written samples of receptive and expressive language. Reading, what is reading? Well, it's the process of looking at a series of written symbols and obtaining meaning from them. Written symbols like the letters that are there that are combined into words, like the quotation marks that are there. Now, see, those are two different types of symbols, and they have their own meaning. We can decode the words, but we cannot decode the quotation marks. So any type of graphic representation, the symbol for dollar, it's not a spellable, it's just a symbol, or the @ that we use now in emails. In the old days, that was a measure of weight, a symbol for a measure of weight. So what do we need to read? Well, a long time ago, in 2000, I'm sorry, the National Reading Panel told us that in order to teach kids to read, we have to teach them 5 basic things, what they call the pillars of reading, okay? And those are phonemic awareness, okay? The manipulation of the sounds within the words, phonics, sound symbol association, the letter sound knowledge, the fluency, the rapid and accurate word recognition. And if we're talking about fluency, when we're dealing with discourse, then it's also the prosody associated with it, vocabulary, the meaning of the words, and comprehension strategies. That's what's needed in order to read. Why is that important? If I know that, then I know what I have to test. It's as simple as that. So understanding all of these foundational elements of the science of reading tells us what are the things that we need to test if we want to assess for reading problems. It's very simple. Writing is the opposite of reading, is the representation of oral or gestural language by means of writing, of a writing system, okay? Where is the prosody or melody on speech when we write? In the punctuation and the use of metaphors and similes, you know? So it requires various cognitive operations to translate ideas and thoughts into written language. So how do we then use all of this information when we know that there's so many other factors that affect the child? Okay, so the idea is that we're not going to look for a diagnosis right off the bat. What I'm going to look for, first of all, is where are the problems? And all of the problems that we can have can be divided into 4 primary areas: work, behavior, social relationships, and health. So if you're not doing badly in school, if you're not driving your parents and your teachers crazy, if you have at least one friend and you're not sick, life's okay. Anything you get above that is wonderful. Anything below that, we got a problem. What we call it is not important unless you're looking for services or you want to read about it. Diagnoses are important, but what is important is to understand what are the problems that those symptoms are causing. And where do we go looking for those problems? Well, there's four areas four factors that contribute to it. My developmental profile, my learning style, that includes my level of developmental functioning, my processing speed, my ability to attend. Can I process visual, auditory, or tactile information appropriately? How's my working memory? How are my executive functions? How is my ability to communicate orally or in writing, my fine motor control, all of those things, and they're all interacting with one another simultaneously. In addition to that, I need to know what the behavioral and emotional profile of this student is. Why? Because if I have someone that is terribly anxious or terribly depressed, that's going to impact processing speed and working memory. It's going to impact their ability to attend, which in turn is going to cause significant disruption in all of the aspects of cognitive development. I also need to know about the child's health, because if the kid is not sleeping, for whatever the reason, whether it's because of a disruptive environment, because they have a sleep disorder, because they have sleep apnea, because they're anxious, if they don't sleep, they're not going to be alert the next day. And if they're not alert the next day, they're not going to be able to pay attention. And if you can't pay attention, you're not going to be able to learn. And then we need to look at the environment. And there are three primary environments that we look at. Early on, we look at home and we look at school. And then when they get to middle school, the peer group becomes the primary influence in the child's life. So we need to be aware of what's happening in the peer group. If you give me a good description of what's going on, I can formulate a good prescription to handle it. So if we think about the principle of consequential validity, if I did an evaluation to understand what are the contributing factors that can help me identify what I can do, then I can figure out, how do I teach this child? How do I manage whatever aspects of behavior and emotions that need to be addressed? Do I need to provide medical interventions? What can I do environmentally to help this child? And this is applicable to every single problem that we see. So if we get this bird's eye view, where are the problems? Then we can then go through the process. So let's do a little case presentation here, okay? We're gonna talk about Johnny. They write books about Johnny who cannot read. Well, this is the one who cannot read. This is the case study. He's 7 years, 4 months old. He's entering second grade. And the concerns are that he had trouble acquiring basic reading and writing skills. He does not pay attention and is hyperactive and has behavior problems at home. That is the main concern, okay? So based on the science of reading then, what do we need to do? Well, we need to evaluate the developmental profile of this child, the behavioral and emotional profile of this child, health, and the environment. So let's look at reading then, and what the science of reading tells us about reading and how it develops. And then that can inform what we can assess. So most of you, if not all, are familiar with the reading rope from Holly Scarborough. And what she tells us is that we have two components to reading: the mechanical component of it, which is the how do I read, the decoding of the words, the sight word recognition, okay? And when it comes to writing, the spelling. And then I have the comprehension part of it. So that's a more complex part. So what happens is when we first start school, I have to be able to acquire the how to read skills, while at the same time I'm beginning to develop background knowledge, vocabulary knowledge. I begin to understand the language structure, the verbal reasoning, and the literacy knowledge, the genre and things like that. So what happens throughout the years is, if we look at the phases of reading development described by Aries, we have the pre-alphabetic stage, and that's typically between pre-kindergarten and the early part of kindergarten, okay? We then do the partial alphabetic stage, where here they're beginning to get more letters and they can begin to decode code, simple words. So that's the second part of the kindergarten and the first semester of the first grade. They are able to combine letter sounds to do that. Then we get to the full alphabetic stage. So at this point, they really have all of the sounds of the letters. They understand the orthographic combinations that can give us, you know, the O, GH, and all of those things that drive us crazy in English, particularly when we're learning it as a second language. And then we get to the consolidated alphabetic stage. By that, now we're really beginning to read. Okay, the fluency, that automaticity component is there. And by the time we get to the third grade, that's all developed. And what you see in the school systems is that it is from pre-kindergarten to the third grade that we teach kids how to read, how to write, how to add, subtract, and multiply. And then after that, we don't teach them that anymore. They're reading to learn, they're writing to communicate, and they're using computational skills for problem solving, for mathematical reasoning. Okay, so that's why it's so important to start early. If we look at what Goff and Tumner tells us in the simple view of reading, what we have is that, looking at it in a very simple way, if I look at my decoding skills and I multiply that by my listening comprehension, that will give me my reading comprehension. If either one of these is 0 or less than 1, I'm going to run into trouble. So people that have problems with the mechanics of reading, decoding, and fluency, the word level reading, okay, which are things that we learn, we're not born knowing the skills, are going to run into trouble. If I have a language problem, if I don't understand what I hear, I'm not going to understand what I read either. So anything that less than 1 here is going to be a problem. So what do we need for word level reading? As Holly Scarborough mentioned, and this is from Kilpatrick's book, and he really expanded on this a little bit more. We have deciphering the word, and that requires phonic decoding. So I have to have phonological skill. I have to be able to know to manipulate the sounds and all of that stuff. And then I also have to have the letter sound knowledge. That is very, very important. So you see, if I'm going to assess reading, and these are the functions that are required for reading, I need to know this. That's why the science of reading informs assessment. When we look at the fluency component, the sight word memory, I have to have 2 things. I have to have orthographic knowledge. I need to know how the word is written, and I need to be able to associate the sounds with certain letters and certain letter combinations to know how to pronounce that word and recognize it quickly. That's what happens, okay? When it comes to the other aspect of it, the listening comprehension, we can look then at the language skills. You know, we did phonology and you know, morphology and things like that before. So we need to look at syntax and grammar knowledge, vocabulary, and the more abstract language skills. But we also need executive function. So attention is going to play a role here. Comprehension monitoring, okay? I got to be paying attention to what I'm doing to see how this relates to the previous knowledge. Attention, if I'm not paying attention to what I'm reading, I mean, how many times have you read something and then you go, I have no idea what I read because I was thinking about something else. That's what attention or lack thereof will do to you. And then, let's see, working memory. Okay? And working memory is where you hold all of that information and manipulate it. These are all elements of executive function. Without executive functions, you're not going to be very strategic in your reading. And then you have to add your text knowledge, as you mentioned. The background knowledge is what is my general and topical knowledge. You see, if I were to start talking to all of those language people and you start talking about math learning disabilities, there would be a problem because we don't know as much about the science of math as we know about the science of reading. And we don't have necessarily all of the vocabulary, okay? And then also, what type of book am I reading? Am I reading a novel? Am I reading a journal, scientific journal? Reading a marketing article? So that's how we look at it. So based on that formula, we can only have 4 types of reader. We have readers who can have either weak decoding or strong decoding, or those who have strong listening comprehension or weak listening comprehension. So a typical reader has strong decoding skills and fluency and strong listening comprehension. A dyslexic reader has weak word reading skill, but strong listening comprehension. A hyperlexic kid, which is really a kid with a language disorder, can decode very well, but has no idea what they read. Okay? You know, many of you, like I did, I learned French when I was in high school. Unfortunately, I haven't spoken French in years, but I still remember how to read it. So I can read French, but I have no idea what I'm reading. I'm a hyperlexic in French. And then you have the mixed reader that has trouble not only decoding, but also with the listening comprehension. And those are the 4 types of readers that you have. So if we look at dyslexia, we all know that it is a type of learning disability. The origin is neurobiological, and the symptoms, okay, which is what we want to know. Poor decoding and spelling abilities, as we talked about, problems with accurate or fluent word recognition, and is not consistent with the age or with the cognitive abilities. Okay, so this is a smart kid who basically can sound out words and cannot read fluently. So we have a problem here. The cause is deficits in phonological processing, the inability to process the sounds within the words, and also the rapid automatized naming, the ability to rapidly retrieve visual information and add meaning to it. Okay, it's unexpected because these kids are being taught like everybody else, and as I said before, they're smart. And what are the consequences? Poor reading comprehension and poor vocabulary and general knowledge development. When we talk about language arts, the goal of language arts is to make us talk as educated people, eloquently, to learn vocabulary. Well, most of the vocabulary, especially the scientific vocabulary, the specific topic vocabulary of social sciences and things like that, you're going to acquire that through reading. You know, and that has to do with your academic language, and that develops. Most of it develops after the 4th grade. If we look at how the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, the most recent text revised, which is the last one, describes learning disorders. We have 3 types of learning disorders, main learning disorders. So we have a specific learning disorder with impairment in reading, and we can have 3 types of reading disorders there: problems with accuracy, fluency, or comprehension. We have 3 types of SLDs with impairment in written expression: spelling accuracy, grammar and punctuation accuracy, clarity or organization of written expression. And with impairment in mathematics, so we have number sense, memorization of math facts, fluent computation, and math reasoning. What are some other labels for this? Dyslexia, which is accuracy and fluency in reading with poor spelling. Dysgraphia, which is grammar and punctuation accuracy and clarity of organization of written expression. And dyscalculia, which is the computational aspect of math. That's what it relates to. So as you can see, except for dysgraphia, in dyslexia and dyscalculia, the comprehension and the reasoning is not affected. If we look at the other classification, the International Classification of Diseases, and the reason why I mention this is because someone gives you a diagnosis. If you go to a psychologist and they give you a diagnosis, they have to use the ICD-11 code. Otherwise, the insurance company will not pay for that diagnosis if they cover this type of evaluation. So what do they tell you? The cause of these problems: deficits in perception or processing of information for learning academic skills. So some of the processes, and we know here which ones they are because we already heard what Holly Scarborough and Tom Nurengoff have to say, okay? The onset, it begins in the developmental years. That is very important because if I can identify who's at risk, because the history tells us that, then that would be helpful. But that's the manifestations, the impairment, the problems, you don't see them until the kids get to school because that's when you learn reading and writing, okay? So the problems begin during the formal school years, usually after the first semester of the first grade is when we can confirm it, because by then they have had sufficient exposure to instruction to be able to obtain an appropriate level of an appropriate measurement of their level of academic achievement, let's say in reading. Now, you can identify them early on and do an awful lot of stuff, but you don't make a diagnosis until they're old. Okay. The thing is, we can begin to intervene before a diagnosis is made. So we don't need a diagnosis for intervention because we know what the problems are, because we can identify them early on. Okay. Another important thing that they added, both DSM and ICD, I said that they may not manifest until the volume and complexity of the task, affects their efficiency. If they have to do it too fast or the material is very complicated. When does that happen? In middle school and high school. So you may have been able to wing it because you were smart enough. But if you're spending 3-4 times as long to do the same amount of work of people that are half as smart as you are, that don't understand the material as well, that tells you that you could have a problem. And that's where why you find people that say, I was not diagnosed until I was an adult and I graduated from college. And what people don't want to recognize is the tremendous amount of effort that required from these individuals. The symptoms have to last for more than 6 months, okay? And they have to cause impairment. Remember, impairment on work behavior, social relationships, or health. And we see impairment of learning disorders in all of those areas. The performance is either well below average, or it requires extraordinary effort or support to reach acceptable levels. How many students begin to get remediation and accommodations, and all of a sudden they start doing well, and they pull all of the support services? Oh, you're doing well, you don't need it now. They're doing well because they have the support and accommodation. And that's what defines their problem. It's like saying, oh, you could get into the building with your wheelchair, so you don't need the ramp anymore, you know? Or we need to stop the physical therapy to make your arm stronger. So what they both tell us that there's varying degrees of severity, so you can have from very mild to very severe. They often coexist with other conditions. And this is very, very, very important because these problems run in families. They're heritable. They coexist with other conditions. You can have a lot of other problems like ADHD and anxiety and depression and handwriting difficulties. You can have, actually, there's a very high incidence of dyscalculia in many dyslexics, okay? They run in families. But it also tells us what they're not. This is not that their IQ is too low. This is not because they're either deaf or blind. It is not because they have a serious neurological disorder or motor disorder, because they have not been educated, or because they don't have a proficiency in the language of instruction, which deals with a lot of our, English learner students, which we have a lot in Florida. And that's a whole topic. We can talk about how to ascertain language proficiency and all of that, but that takes, that's beyond the scope of what we're going to do today. And of course, psychosocial adversity, because psychosocial adversity can have a tremendous effect on the child, even at a neurological level. From the writing perspective, now we have a wonderful work from John Sedita that did the writing rope, and he talks about critical thinking and syntax and text structure and writing craft and transcription. So assessing fine motor function here will be very important. Proprioception, because you cannot do keyboarding skills if you don't know which fingers you're moving. Generating ideas, gathering information, organizing, drafting, writing, and revising. Those are executive functions. That's what we do with executive functions. Syntax, how do I structure the sentence, the elaboration? Where do I put the punctuation? Oops, and what type of text structure am I going to use? And then, of course, the word choice, you read some books and you go, wow, this person writes so beautifully. And someone can tell you the same amount of information that the book told you, but the story doesn't sound as nice. That's because of the writing. Okay, so now that we consider the developmental aspect of it, all of the cognitive aspects of it, now we need to look at behavior and emotional development, health, and the environment. So how the heck do we do all of this? Well, that's what the structure of an assessment tells us. And what we did is we came up with this model that we call the LEFT model. And it consists of listening, evaluating, formulating, and teaching and treating. Those are the 4 components of an assessment, whether it's a teacher assessment, a psychological assessment, an interdisciplinary assessment, they all have to follow the same process. Look, what does the listening require? Well, as the word implies, you got to hear what people have to tell you. When I was in medical school, our professors used to tell us, if you want to know what a patient has, ask them. They will give you the symptoms and you'll immediately know what's going on. So who do you ask? In this case, you can ask the parents, you can ask other teachers, you can ask the students themselves. And how do you do that? You can do that through direct interviews or through questionnaires or both. Typically it's done using both. Okay? And what that will tell you is what you need to know to decide what tests to use. For example, if you have a kid that comes to you that feels warm to touch, is coughing, has a runny nose, and complains of an earache, you think, well, the kid is warm. Let me get the thermometer to check the temperature. And sure enough, the kid has a fever, but you already knew that because the kid felt warm to touch, and you probably thought, okay, he has an ear infection. It could be bacterial, it could be viral. He has a runny nose, he's all congested, whatever. So we already knew that. So we're doing the testing to confirm the things that we know and to determine which way to go. I would also examine the patient, and if the ears are red and the eardrums are red and bulgy, I'll know that he has an ear infection. Then maybe I prescribe an antibiotic after I have my findings. So in a learning disorder, what do we do? Well, why are you here? What are the main concerns? And that is very important because that will tell us where the impairment is. We need to get a good educational and developmental history because we can ascertain the onset of the symptoms. Remember, they start in the developmental years, but the manifestations do not occur until they're in school. An invaluable source of information, and it's just a quick strategy, is a typical school day routine. How do they get along with peers? Your peers are going to be your toughest judges. They're not going to accommodate you. If you cannot communicate well, if you don't interpret well what they're saying, if you're interrupting all the time, all of these things, that will tell you something. Discipline and behavior management, because we need to know that profile of the emotional profile of this child. Are there any health factors here? And the family history. This is informed by the science of reading and by the definition or the diagnostic criteria for the disorders that we're trying to assess for. Okay, this is what we have just covered. That's why we have to ask these questions, because the science tells you that we must. So let's go back to Johnny's case. When you want to get the symptoms, just the facts, okay? I don't care what you think it is. I want you to tell me what you're observing. And this is important. So, and this was a real case, by the way. The teacher says, this kid had difficulty acquiring basic reading and writing skills, does not pay attention, hyperactive and impulsive at home, has behavior problems at home. Okay, that's the chief complaint. What are they doing for him right now? Well, he has tier 2 support services for reading and writing. Okay, so I mean, I know this kid has problems because he's already getting small group instruction. As a 504 plan, he's hyperactive and impulsive, so he probably has a 504 plan because someone diagnosed him with ADHD. He gets private tutoring, so the tier 2 support services are not sufficient to address his needs. And he takes stimulant medication on school days. Okay, and this tells you what the current interventions are. Now, if this kid came to my office because he's still having difficulties acquiring basic reading and writing skills. What does that tell you about the tier support services and the private tutor? It tells you that he's not working, because otherwise, what would they pay for an evaluation? Okay. Now, what is it that you don't want to see in a chief complaint? So if you're giving someone information, describe to them what you see. If you are obtaining information, this is not what you want to hear. This is, again, from this same child. The teacher this year recommended I have him evaluated for a processing disorder. I don't know what a processing disorder is, by the way, because there's so many things that you can process. That is a, who knows what that is. And has also recommended a special school. So we're making recommendations without even knowing what we're making recommendations for kids with learning disabilities. So I suspect that the processing disorder may be causing a learning disability, but that has not, although he has never been formally diagnosed with a learning disability. Remember, we manage problems, not diagnoses. We manage the symptoms that define them, okay? Only ADHD, for which he takes medicine and has a 504 plan, was denied testing because current progress monitoring scores were not low enough. So the fact that he's tier 2 support services, tutoring, and has a 504 plan, and he's still struggling with reading, that doesn't count because the test scores were high enough. That doesn't sound like good consequential validity to me. So we don't do that. Okay, what do we do for an educational history? I used to tell my residents we're going to go to the bars, okay? We need to monitor symptoms and impairment over time by grade. So that will help us establish the onset of symptoms and requires that you're aware of the developmental expectations and the educational demands. So when we were looking at the reading rope and looking at ARIS level, stages of reading development, that would be important. And what are the bars? Well, behavior, attention, readiness skills, or reading, writing, and arithmetic, and social interaction. That's what I want to know starting from preschool, going to the current grade. In the case of this kid in pre-kindergarten and kindergarten, he was very disruptive, hyperactive, inattentive, and non-compliant. A bit apprehensive, trouble separating from his mom in the morning. First grade, compliance and hyperactivity improved after medication was started. Still somewhat inattentive, still a bit apprehensive, and seems to worry. Okay. Early developmental history, was a little slow to talk, had articulation difficulties, mixes similar sounds when he speaks, and has trouble with rhyming. This was early on. In pre-kindergarten and kindergarten, trouble learning the names of the letters and their sounds. In first grade, struggle to sound out unfamiliar words, poor sight vocabulary, difficulty spelling, illegible handwriting, can communicate well and understands instructions appropriately. So if you think about the 4 types of readers, you already know what category of reader this kid is. He's a kid that struggles with mechanics, but that has good listening comprehension. He struggled with language development early on. He had evidence of difficulty with phonemic awareness because he couldn't rhyme early on. You know, he had trouble with a sound symbol association, you know, letter sound association. So, I mean, these are all of the classical symptoms. You could make a diagnosis because he couldn't rhyme or because he didn't learn the letters of the alphabet. You could make it now that he's entering the 2nd grade because he's older. So this is what we know. We haven't tested yet, okay? Social skills, made friends easily, overwhelmed friends easily in pre-kindergarten and K, problems playing and following the game rules. First grade, better at keeping friends and following rules since the medication was started, gets invited to parties. So again, asking these questions tells you a lot of information. Morning routine. Waking up takes a while. We need to know why. Is it because he's not sleeping well or what? Okay. Getting dressed requires constant supervision. Buttoning, snapping, tying, and zipping. What tells us about this kid is fine motor control. The teacher said illegible handwriting. So that requires also buttoning. You know, you use your fingers to button, to snap, to tie, and zip. What happens at breakfast time? Doesn't sit still. Problems handling the silverware, another fine motor function. And messy as all get out, wears his breakfast on his face. Brushing and combing is a hit and miss. Sometimes he forgets, sometimes he doesn't. Gathering materials needs constant reminders. This paints a picture of what's going on, and it tells you a lot more than any T-score is going to tell you on a standardized behavior questionnaire. Needs reassurance to separate from his mother. Needs reminders when he transitions into the classroom. It is, he couldn't remember 2/3 into the kindergarten where his cubby wall was and things like that. In the afternoon, homework takes forever, is a battle, and he forgets materials. Plays okay, problem following instructions in extracurricular activities. Dinner is pretty much the same as breakfast. Getting to bed is a problem. And when they get him to bed, he's constantly talking about the problems that he has at school. He sometimes has trouble falling and or staying asleep, doesn't snore, and doesn't have nightmares. Okay, I have gathered here so much information. I know that this kid has difficulty with executive functions because needs constant reminders to gather materials, needs constant supervision to get dressed, forgets materials for school. I know that this kid still has a lot of hyperactivity, ADHD symptoms at home. I know that this kid is having problems with sleep, and some of the problems that he has at sleep is that school problems are he unloads on his mom at night, okay? And the teacher told us already that he had, takes too long to get back, but that he was having some difficulty separating. At home, his behavior, is he defiant or non-compliant? He's both, okay? The difference between defiance and non-compliance is that the defiant child heard you, thought about it, and decided, I'm not gonna do it and you can't make me. The non-compliant child heard you, didn't think about it, went on to do it, forgot halfway through and never did what you asked him to do, but he was not willfully disobedient. And these are two very different discipline problems. At home, he can be verbal or physically aggressive and has difficulty with emotional regulation. What do they do for discipline? Timeout, restriction of privileges or others. They do those two. Effectiveness, variable. Works sometimes, not others. Okay, so we need some help with this. Medical history, no problems during birth, no developmental history. We already talked about the articulation and the language problems, no persistent health problems, no allergies, and he takes Vyvanse 10 milligrams a day on school days. Family and social history, parents 38 and 40, both have college degrees, bookkeeper and entrepreneur, learning and behavior and emotional problems were reported. Siblings 5 and 10, one of them has a learning and behavior problem. And close relatives have learning and behavior problems. And my favorite question when I would ask about family history, does it remind you of anybody in your family? And typically the answer would be yes, and they could tell you who. Family and social history. We look for environmental stress factors in the last 2 years, and these are the general things that we look for. And in this case, there were none. Okay, so what does the history told us? Well, what are the strengths? In school, he does well in math. He's good at sports, behaviorally. At school, he's respectful of his teachers, but at home, he can be sweet and loving. Social interaction, makes friends easily, but can lose them. No health problems, stable home environment. That's what the history told us. What did the history tell us about impairments? Difficulty acquiring basic academic skills in reading, spelling, and handwriting. At home, he's irritable, defiant, non-compliant, emotional, and aggressive. At school, he's apprehensive and has trouble separating from mom, makes friends easily, but can lose them better since Vyvanse was started. Social environmental, strong family history of learning and attention problems, but has a stable family. So that's what we know. That's what the history told us, a ton of information. So now we go and test them. Let's see what the testing shows. We have comprehensive assessments. And of course, we have the 4 components, the left components. They all include a history, they do testing, they do an assessment or formulation, and they usually make some recommendations. We usually have psychoeducational assessments that if they're done by the school, for the most part, they don't make diagnoses, they don't make recommendations other than to refer to the team. So the consequential validity of such an evaluation is really not what it's supposed to be. The psychological assessment usually focuses on diagnosis and treatment. The neuropsychological assessment also looks more at the causes of the problems with diagnosis and treatment. And the multidisciplinary evaluation does the same thing as the neuropsychological, but in greater detail, because it has more people that look at different functions in more detail. They all include a history, testing, and observations of the child. So let's look at Johnny's standardized testing now. What did it show us? Well, the first thing that you read in a psychological evaluation is the behavioral observations. The test lasted 4.5 hours. He was polite, friendly, and outgoing, so we didn't see the irritability, the defiance, or anything that we would describe at home. He was easily engaged and showed good rapport, excellent interpersonal skills. So, I mean, this was a very likable kid. Attention, verbal tangents in the middle of task, more stream of consciousness rather than avoidance. In other words, he was not being defiant or avoidant. He just got off on a tangent and there he went, you know? But he was easily redirected, so the examiner could bring him back. No significant hyperactivity. He had taken the medication that day. Let's look at the testing. Okay, so if you think of the standard scores as currency, you know, they always give you like standard scores or percentiles or whatever. But if you plot them on a bell-shaped curve, it helps you. Here, what we know is that from 90 to 110, we have what the average range. The low average range is 90 to 80. The high average range, 110 to 119. 120 to 129 is the superior range. 79 to 70 is the borderline range. And then below 70, we're in the intellectually deficient range. And above 130, we're in the very superior or gifted range. And what I have colored here is, this is one standard deviation below the mean, one standard deviation above the mean. This is, and that will help you put it in perspective, okay? So what was the verbal comprehension score? It was 111. Look at where it places it very nicely. Visual spatial abilities were 100. Fluid reasoning on the IQ test, this was a whisk, 94. Working memory was a 79. Processing speed was an 83. And the full scale IQ was a 94. Now, does that full scale IQ really paints a clear picture of this pattern? If you were looking at the performance rating of the parts of an engine, and you were trying to tune up that engine and get all of these parts to work in unison, you could never get this car to run smoothly. So what we're seeing here is that we have significant weaknesses in working memory and processing speed. Okay? We have strengths in fluid reasoning, visual spatial abilities, and especially in verbal comprehension. Okay? And, you know, an IQ of 94 places the kids in the 34th percentile, which is really at the bottom end, even though it's still solidly within the average range. When it comes to academic performance, that would be okay. And what an IQ supposedly predicts is your academic performance. When we look at achievement, we see that overall reading composite was 84 in the 14th percentile. Okay, so that tells you that basically 86% of the kids his age read better than he does. Written language was in the 6th percentile. Now, that is very, very, very low. Sound symbol association was the 74th percentile. Orthographic processing, remember, these were the functions that we described before, was 81. Decoding was 80. Sorry, I gave you those backwards. Now, here, overall comprehension score was a 99, but the reading comprehension was an 87, yet the listening comprehension was 111. And remember what his IQ was? It was 111. So his verbal IQ. So what you see here is that this is a kid who listens very well, but has a terrible time with the mechanics of reading. So what we did was we took the temperature on the symptoms that we observe on that child, because we already knew that this kid had problems with letter recognition, sound symbol association, decoding, and fluency. We also knew that the oral expression, okay, was a 94, but we had written expression of 77, really low, but oral expression of 114. So what we're seeing here is that the testing didn't give us any information that we didn't already have. It simply told us how severe the problem was or how strong the skill was. Okay. So we see that listening and oral comprehension listening comprehension, and oral expression were strength. And we see all of the functions that affect reading were a problem. He was also given the comprehensive test of phonological processing. And just if you look at the percentiles, 9th percentile, 16th percentile, 25th percentile, that is just on phonological awareness. So it was on the 12th percentile, really very low. Memory for digits here was 2. Non-word repetition, 25th percentile. So, I mean, here, 98% of the kids did better on memory for digits than he did. The phonological memory that is required for fluency was extremely low. Rapid digit naming and rapid letter naming, which is the RAN, was good. So at least that aspect of it was okay. They also did the BASC, and clinically significant scores were found at home for internalizing, externalizing symptoms, and attention symptoms. Okay. Borderline clinically significant for internalizing symptoms and attention symptoms at school. So what does this tell you? Why is this kid acting out at home? Okay, the vast majority of people would say that is because the parents don't know how to discipline them. But if we look at the history that they gave us and we look in more detail, we see that there was a little bit of a borderline increase in internalizing symptoms here, and we see a clinically significant internalizing symptoms here. And one of the things that children show, particularly very young children show, when they have an anxiety problem, is that they can become very oppositional and defiant. Because when you're anxious, you have 3 primary responses. You can freeze, you can fight, or you can flight, you can run away. And when they're told to do something, they may react in a very defiant way, because there's no way you're going to make me do that. I will not do it. So what is the formulation? How do we put all of this information together? Well, there are 5 questions that need to be answered on every evaluation. Is there really a problem? Or is it, as the grandfather said, oh, he's just a boy, or his sister talks too much for him? If there's a problem, what do we call it? Does it have a name? What causes it? And then what can be done about it? Again, consequential validity here, guys. This is the first slide that we have, and this is how we're going to end. So how do we teach him? Is the student eligible for services, and what other services or interventions are needed? Because again, we need to be looking at the whole child. Finally, what can be expected in the future? Well, if we go back to the rule of 4s, we have a description from the history and from the testing of all of these issues here. So organize it conceptually. Okay. What do we know about the developmental profile? Developmental level of functioning was high. Processing strengths and deficits, we saw that in the testing. What were the scores and what were the attention and executive function? What is the behavior and emotional profile of this child? Are there any health concerns, including sleep, any environmental, social factors, or peer interactions, problems that are impacting what's going on? What are the diagnoses? So let's start with the diagnosis. Based on the findings of this evaluation, we made the following diagnosis. We have a specific learning disorder with impairment in reading based on lack of word reading accuracy and fluency, also known as dyslexia. But at time that I saw this patient, the state of Florida did not recognize dyslexia as a diagnosis, but would recognize a specific learning disorder with impairment in reading based on lack of word reading accuracy and fluency, which is the definition of dyslexia, but the term dyslexia was not recognized. A specific learning disorder with impairment in written expression based in deficits of spelling accuracy, grammar, and clarity of written expression. Those are very clear diagnoses based on the history and the findings. We have an attention deficit hyperactivity disorder combined presentation. We have a developmental coordination disorder. And I did not get into the assessment of handwriting on this kid, but we could see it in the pencil grip, plus we got it from the history of a typical school day. Has an oppositional and defined disorder because he's ornery at home. But he also has anxiety traits, not enough to meet any specific diagnosis of anxiety, but he is an anxious kid. So that's why it's called other specified anxiety disorder. It's other, but so that's what this kid has. So if we answer those 5 questions, what would we say? Is there really a problem? Yes, there is. What do you call it? Dyslexia, dysgraphia, dyspraxia, ADHD, ODD, and anxiety, oppositional and defined disorder and anxiety. What are the causes? They're neurological and genetic in origin. There are deficits in phonemic awareness, rapid automatized naming, working memory, fine motor control, attention problems, anxiety symptoms, all impacting one another. These are not independent silos that don't mix. These are like the ingredients in a cake, okay? What can be done about it? Well, we can intervene educationally, psychologically, medically, and environmentally. What can be expected in the future? We can be successful if he's remediated and accommodated appropriately at school and we address the coexisting condition. We just do one or the other, but not all, then we're going to have more problems. So this is not an issue. Do I provide remediation with structured literacy for this kid? Or do I provide medication? Or do I do cognitive behavior? You got to do it all. Easier said than done, and I understand that. So how do I explain this to a patient? Well, you need to discuss the findings and don't ever forget the strengths, because that is very important. So developmentally, what is the problem? You're smart, but you can't read or spell due to differences in your brain that impact your ability to really hear all of the different sounds in the words, remember the names of the letters, and to recall them quickly. But you understand what you hear very well. That makes reading and spelling difficult. It has a name, it's called dyslexia. You're absent-minded and spacey, but not lazy, because I know you put forth a lot of effort in what you do, but half of the time you forget what you need to do. The other half of the time, it takes you so long to do it that you can't do it, okay? So why does this happen? Because you have these chemicals in the brain that help you control your attention, kind of like the brake fluid in your car, and you're low on brake fluid. And we need to give you a little bit more brake fluid. The name of this is ADHD. You tend to worry a lot, and that makes you crabby, and at times makes you defiant at home. You get nasty with your parents. And this is due to excessive survival of the neurotransmitters that are exacerbated by the chronic stress at school. So in other words, I have someone who by nature tends to worry a little bit, and now he goes to school and fails every day. So of course he gets anxious. Okay. Gets along well with other kids. He's healthy. It comes from a good, stable home environment. So for the parents, it's not your fault. It's just your problem. Let's figure out what the heck we need to deal with it, to deal with this. Okay. So what do we need to do now? Let's teach and treat. Okay. There are 4 areas of intervention according to the rule of 4s. The educational part. We remediate. What is remediate? We emphasize the weaknesses. We want to narrow the gap between this kid's performance in reading and writing and that of the other students. So that requires intervention through the structured literacy, which is beyond the scope of what we're going to talk about today. We need to teach this kid executive function strategies, because otherwise we're going to have to send him to life with an executive secretary that can handle all of that for him. So we need to teach him. good executive strategies. Accommodations. Okay, we're going to use your strengths to overcome your weaknesses. Since you do good reading, listening comprehension, maybe we can use assistive technology when we begin to teach content. You can listen to the books. Since you communicate orally very well, maybe you can dictate and use voice-to-text technology. Okay, and that's not cheating. That's simply, if I'm going to assess content, then I want to know what you know about science and what you know about social studies and what you know about art, and you can do it that way. If I want to know what you know about reading and spelling and grammar, then, well, the grammar I can assess through oral language. But anyway, you may have to test those other functions separately. I can give you someone to take notes for you. I can hand you, I can give you a handout on my PowerPoint lesson, and I can give you more time because I know that it takes you longer to complete the task. Okay. Then there's modifications, but modifications can impact sometimes diploma requirements. But at home, limit homework time. This kid goes to school, 6 hours a day, 5 days a week, 10 months a year. Then he goes to tutoring. Then he has to come home and do homework. This kid needs a life. So let's make sure that every day in his life is not defined by his challenges. Make time for positive activities. And then, well, in the state of Florida, we cannot talk about social emotional learning anymore, but again, these are the strategies that we would like to teach at home to help the student recognize how they're feeling and what they need to do. Psychological interventions, well, the parents may need a little bit of help with behavior management to address the defiance and non-compliance, and cognitive behavior therapy to address the anxiety symptoms. Medical, I called this doctor back. I would say, you know what? When he takes medication, he doesn't have as many problems with compliance. He can complete his work. And part of the problem is that the parents feel guilty because they think they can manage this on weekends and holidays. And medication is to manage symptoms that are present 24/7. And if you take the medication 7 days a week, you develop side effects to the medication a lot easier than if you don't take them 7 days a week. So that would be, if the teacher would call me and send me a report like the one that I just gave you, I would tell the parents, you need to do this, and you may need to use a booster dose of medication in the evening because you're still having a heck of a lot of trouble with this kid's homework. The medication that this kid is taking is supposed to last 12 to 13 hours. So maybe we can up the dose and optimize that dose and may not need to add anything else. Or he may need a different medication. And I mention this because this is important. This cannot be ignored. Environmentally, what can we do? School preferential sitting, short leash, arrange the schedule to teach them the difficult subjects early in the day. It's a lot easier early in the morning than later in the day, and maintain a consistent schedule. Why? Because that's the same thing that we're going to do at home. Why? Because if you're consistent, you're predictable, and if you're predictable, you're dependable. Instead of having to tell them things 100 times, you only have to say it 50 times. That's a 50% return on investment. Okay, if you do the same thing the same way every day, that helps. Okay. Provide time for leisure activities, limit homework time, promote extracurricular activities that focus on the kid's strengths. If the kid struggles significantly with reading and writing, it is highly probable that he or she will not make a living reading and writing, may do other things that not require that much of those skills. And last but not least, we need to manage parental stress, because if the parents are all stressed out, they cannot help the kids relax. So take a deep breath, relax, because if you're okay, your kids are going to be okay. Exercise is free, releases endorphins, and it relaxes you. If you have a significant other, go out on a date, okay? Or go out on a vacation, which are defined as going out without children. Vacations with children are family trips. They're not vacations. You need vacation coming back from a family trip. But this is important, and it's really important to manage the stress. And with that, I'm going to stop, and I'll be happy to answer any questions that you have.
Wow. Before we get to the questions, thank you so much. I've heard you speak so many times, Dr. Tridas, and I always learn something new. You take something so complicated and comprehensive and make it so clear and understandable. So I hope everybody else felt the same way, but I just thought that was awesome.
Thank you.
Thank
Thank
goodness
you.
that we will have the recording, we will have the slides. So for those of us who process a little more slowly, we may have to go back and read it a couple more times. But we did have some really good questions coming in. So
Okay.
I'll take one, and then maybe Melissa can take one, and we'll go back and forth.
I'm going to stop sharing screen and we can go.
Yes. Okay, I'm going to start from the top, from the Q&A. So Bonnie says, should we be concerned that the norms from standardized tests no longer mirror the population's average performance after COVID?
Well, if you look at the National Assessment of Educational Progress scores after COVID, they didn't change that much. So the impact of COVID, while it has been significant, and in particular for the vulnerable populations that we're talking about, from the academic perspective as a population, not individuals, maybe there was a lot of instruction that was missed. There was a lot of high quality instruction that was missed during the COVID pandemic. So the National Center of Learning Disabilities put out, it was years ago, a really very good document. It was like a white paper on remediate, on how to address the needs of the students in the pandemic. And there were two primary problems with the pandemic. One was the academic impact, the educational impact, but the other one was the emotional impact, and that one was more severe than the educational impact. And they made some very good recommendations. In summary, for remediation of academic work, small group instruction is important. Simplifying the curriculum. In other words, take the fluff out and focus on the basic elements that you need to teach and increase the practice of the basic skills to help them develop. And they had quoted some studies that showed that in mathematics, for example, they could improve with more intensive small group instruction. They could improve academic performance by a year and a half in a year or something like that, or maybe even less months. I can't remember, but it was, I was dumbfounded when I saw the results of that study. So I would do that. The main thing is mental health issues really were exacerbated during the pandemic due to the isolation and all of that. So again, that's a whole lecture, that's a whole set of topics. Mm-hmm. But the norms are important because in 2 years, those kids will still need to be performing at a comparable manner than those kids that came before them and after them. So we need to ensure that they have the same level of skill. So yes, I would use those standards to tell us how, to tell us how high the fever is, if you will. How low are these kids? How much emphasis do we need to put into remediation to narrow the gap of the performance? And that's where the remediation comes into play. This is not about accommodations. This is about remediation. Accommodations are very good for content, but remediation is important for skill development. That is a very important concept to have. And remember, you have 3 years to teach that. So let's not have them cut too many things and do too many, projects that are not going to help them read, write, and do math. Put the emphasis on that.
Thank you. Melissa,
Judy,
you want to do one?
Yes, sure. Terry asks, I'm curious how processing speed, or more specifically slow processing, affects reading, and if there are steps to take to support students who are bright but have slow processing.
I had a patient that actually ended up going to Harvard as the slowest processing speed on earth. I tell her, you're a 12-lane highway with a school zone speed limit, What processing speed is all about. You can process information, you just don't do it as fast. So what do? You increase automaticity of the skill. Okay, and this patient was so brilliant that in the end, could wing it. But automaticity is what helps. It's the same thing as those kids that have low working memory. You know, if you automatize the skill, so if I don't spend my energy, just working memory is like the RAM of your brain. Okay, so I have to hold information temporarily. Let's say I'm gonna decode the word cat. So I got to look at the letter. That's the C. That sounds K. I have to hold that sound and go to the A, do the same thing, then go to the T, the same thing, and then blend the sounds, manipulate them, and then I have to go back. Oh, cat. That's a fairy animal that purrs and all of that stuff. Okay, so if I spend all of my energy decoding, I cannot spend my energy on the more strategic thinking that Holly Scarborough was talking about in the comprehension aspect of things. And we're beginning to get the first summer storm of the west coast of Florida tonight. I just heard it.
Uh-oh.
Hopefully, I will stay. Those of you who are from Florida will know exactly what I'm talking about. Anyway, so that's what I would do. Practice for automaticity to improve the technical aspect of the concept so that they can increase capacity or they can increase speed.
Okay, thank you. We're going to move on so we can get to as many as we can. Kathy asks, is there a reason that some psychologists are performing evaluations all in one day rather than break them up into 2 sessions?
Those are individual preferences, and it really depends on what the evaluation is. You know, in our office, we used to do the intake, the history, and because it was an interdisciplinary relation, I used to do the medical examination on the child, and we did hearing, vision, all of that stuff, and did a quick screening on the kid. And then the psychoeducational assessment was done afterwards on the second day, and then we would have a feedback session on the third day. But if you're driving 400 miles to have an evaluation, then they may be pressed for time. So it really depends. You know, you can develop testing fatigue. It's hard enough to sit in front of a screen at 7 o'clock at night. You know, so testing is not fun at all. So, you know, those are individual professional practices, and it also has to do with the examiner's availability in their schedule. You know, they may not be able to schedule in any other way in their particular practice.
Okay, thank you.
Like, do you want me to take the next one?
Please.
Okay, so what do you do when students have ADHD symptoms, but parents are not giving their children medication? Do you have any suggestions?
Yes. First of all, as a physician, I make recommendations and parents make decisions. Okay. As a teacher, you make accommodations. But if the accommodations are not sufficient to address the student's needs, then the student may require a more restrictive environment to address those particular needs. Now, that decision is the parent's decision, okay? But you cannot expect that, you know, and I used to tell that to my patients, you can decide whatever you want, but there will be problems if your child cannot self-regulate. If the developmental expectation is for self-regulation, to have sufficient executive functions, and even though the pill is not going to make you more organized, at least it makes you more attentive or less inattentive, less impulsive. And if you have attention and impulse control, it can allow you also some cognitive flexibility. So, I mean, again, EF is a totally different concept, but what the medications do is they increase productivity and accuracy of work. They increase compliance and decrease disruptive behavior, and they increase social awareness because they pay more attention to the nonverbal communicative skills and to the prosody and to all of that stuff. They're not intrusive. Okay? So this is what the medicine does. We try to inform the families. Now, as an educator, that's a lot harder, but these are all medicines. So again, that is up to the parents. But as a school, what you say, well, this is all that we can do at this point. If they want to, you know, if they want a behavior shadow with the child, they're going to have to fight that out or whatever, but that's not going to take care of the kid's problem. All that does is this child this child's behavior, regulation, and productivity is strictly dependent on environmental accommodations. And if you that will make this child less independent than what they need.
I have one here from Regina. Do you have a PowerPoint or handout to determine the differences between dyslexia, dysgraphia, and dyspraxia when trying to identify the student's assessment results, like a flow chart? Would you have anything like that?
In my head. Okay. I sort of put a little bit of that in there. The dyspraxia is the motor component of things. So that would give you the handwriting difficulties. So the way that I would look at it, if you take the DSM or the ICD-11 diagnosis under learning disorders and you look at the subcategorizations, that's how I envision it. If you were to develop what they would call an AI algorithm, you know, if I were to develop an artificial intelligence code that would help diagnosis, I would look at the things that relate to phonemic awareness, to rapid automatized naming, as the two main elements there. But you know, again, I mean, you just look at them and you create that in your own. I used to have actually many years ago this huge spreadsheet that remember those big charts that they used to have, or they used to make behavior charts out of that was like a big graph paper. And I used to have there all of the tests that we gave and all of the skills that they assessed so that we could narrow it down. But I don't have anything in a slide. Sorry, that was a long answer to a short question.
Okay. I wanted to ask one that's in the chat because I think this is very interesting. This is says, hello, Dr. Tridas. I was wondering what you thought about the Orton-Gillingham instruction method and their efficiency on children with dyslexia. What other instructions do you recommend that may have better outcomes? As the prior president of IDA, I just had to get that one out there.
Well, Orton-Gillingham is just one of the structured literacy methodologies, and structured literacy, what it tells you is that there's two components to it. You have the how you teach, which is in a structured, systematic, sequential, multi-sensory, and repetitive way. You repeat because you want to practice. And the other one is the content. You teach the skills that you need to do it, and you start with the easier skills first, and you begin to scaffold. So whether you use, you know, any of the structured literacy programs, one is not better than the other. And as a matter of fact, when you deal with very experienced teachers, dyslexia specialists, and things like that, what they do is they combine different programs to see what strategy will work best. They are all based on the same principles. They just use different bags of tricks, and they use slightly different approaches, but they're all consistent with one another. If you want to look at programs that are evidence-based, as is OG, that have been shown to be effective, the International Dyslexia Association provides a list of programs that have been accredited. And part of the accreditation process requires a reaccreditation every so often, so to make sure that they continue to be effective and all of that stuff. So you look at independent agencies, but if you do Wilson or OG or Spire, Spalding, whatever, I mean, I just giving names. It all boils down to the fidelity with which is delivered, the intensity with which is delivered, and depends on the severity of the problem that the student.
What I wanted to add is if any parents or teachers out there want a PowerPoint that I did recently for Just Read Florida on structured literacy and dyslexia, I put my email in the chat. So if anybody's interested, I'm happy to share that PowerPoint. I mean, it's not about assessment, but it's about the intervention piece, what this person is asking about. So I'm happy to do that. as
So,
well.
I mean, and Judy, if you want to add anything to it, that's my, you
No,
know,
I appreciate that. I think we
airplane.
have a few more questions. One person wants to know why social and emotional issues cannot be addressed in Florida. You mentioned something.
Was part of the law, the new law that was passed, that's just not addressed anymore. So I actually, that was included. I am in a work group that is developing standards for the assessment of learning disorders by LDA, and I chair the group that developed the assessment standards for dyslexia for IDA. And the LDA group wanted to include social emotional interventions for school, and usually just included that as behavioral interventions, but they wanted to include that as part of it. So that's why it's included there. But again, that we can deal with that. Is it beneficial? Yes, but if the state does not allow it, the state does not allow it, and that's it. I mean, we just get it elsewhere.
Right. One other thing you mentioned, and you said when you were in your office, I know you're now retired, but still working every day. I know that. But you mentioned that you couldn't use the word dyslexia in Florida. But now I just want everybody to be totally aware that, yes, we can mention it. It's in the law. And I always have to say this for the teachers who are out there, if you are reading endorsed, the new updated endorsement competencies include the word dyslexia 44 times. I counted them. So I think it's just good for us, at least in Florida. I can't speak for the other states, that we are addressing dyslexia and hopefully doing something about it so that all children can read.
And through the excellent work that the Florida branch of IDA has done, and Judy has been a leader at it.
Thank you, Eric.
It's the truth.
Thank you. Any other questions, Melissa, that you see there?
You're muted, Melissa.
Sorry about that. Amber has a question. When an eighth grader struggles comprehending lectures and reading materials and has very low working memory and processing speed, would you recommend accommodations for lack of executive functioning skills, or focus on comprehension strategies, or both, or some other high leverage strategy to address this big hurdle?
It is impossible to make a specific recommendation without knowing the particular individual. Because as soon as I hear those difficulties, my next question is, well, what is this? What is that? What is the other? And that would be an evaluation, and that takes hours and hours of putting all of that information together. Obviously, you know, if you have a problem, yes, accommodations will help because you use the strengths to overcome the weaknesses. But again, if you don't understand what you hear, you're not going to understand what you read. If you cannot say it, you cannot write it. So that's the way that I would look at it. Not having enough information, it's very, very difficult to assess that. We're talking about a middle schooler, 8th grade going into high school. So at this point, what we need to be also thinking about is not only where are the problems, but where are the strengths? Because at this stage of the game, we need to begin to look at, okay, what is it that this particular student does well, and how we can reinforce those skills, because it is highly likely that those are the skills that they're going to be using as adults to support themselves. And it will boost their self-esteem.
Okay, and I think at that point, I know there are a few more questions, but it's right about the 8:30 mark, and we want to respect everyone's time. So Melissa, I don't know if you had a chance in between to randomly select 3 lucky winners.
Yes,
I want to show everybody what the book, that if your name is going to be announced, it looks like this, Assessing Dyslexia. Okay.
Yes, I have Amber Hansen, Deja Diapella, and Tracy Trins.
Okay, if those 3 people can just send us not your email address, but your mailing home address in the chat, and we will get those books sent out to you as soon as we can. Okay. Can you say them one more time, Melissa?
Yeah, sure. And I could put the names in the chat: Tracy Trins, Deja Diapella, and Amber Hansen.
And of course, anyone else who would like to order their book, it's available on Amazon.com. And the paperback is quite economical. You get a lot for your money. So just put a little 2 cents in there for Dr. Tridas' book.
Thank you.
You're welcome. The other thing I would like to say is that next month on June 22nd, we're in the process of putting together a screening of the film, The Right to Read. We're working on the company right now, and we're hoping we'll have it available for Thursday night, June 22nd, from 7 to 8, and then we'll have a panel discussion afterwards. So if you want to mark your calendars and check our website regularly, and we should have more information very soon about that. And then we're working on other webinars for the rest of the months for this year. And please keep in touch with us, send us emails, check our websites. If we get a chance, we'll go through all the questions and maybe we can send them to Dr. Tridas and in his spare time, which I know he doesn't have any. He'll maybe give us some answers. So
Sure.
the name of the book again is called Assessing Dyslexia, A Teacher's Guide to Understanding and Evaluating Their Pupils' Needs. Okay, and it was 2023. Melissa, did you get a copy? Did you get the addresses? I see Tracy
I got Tracy's.
and here's Deja, and there's just okay. Well, we don't want to hold everybody else up, but if the last person could just throw in their home mailing address, we can get those books sent out to you. And thank you again to Dr. Tridas and to all our participants. I think we had over 120 live participants, and we had around over 400 who registered for the event. So hopefully they will be watching the recording. And remember again, the slide deck will be available in a week to 2 on the website. We also put it the link to it in the chat. So again, any questions, if there's anything we can help you with, we're here to help you. So thank you again, everybody.
Thank you all.
All right, and I got all the addresses, so
Wonderful.
we're good to go.
Perfect. Thank you, Melissa. Thank you, Mandy. Thanks, Eric. Good night, everybody.
Good night.
Bye. Have a good summer.
Bye.
Bye.
Bye, Eric.
Bye.
So what did you think? I think it went really well, huh?
I
Hold on
mean,
a sec.
good.
Hold on. There, I'm stopping the